Top U.S. health experts testified before a House subcommittee Thursday on the nation's response to the coronavirus pandemic. Dr. Anthony Fauci says that the U.S. is in a race between vaccinating Americans and a fourth wave. The nation is averaging more than 60,000 new infections per day. Fauci says that number needs to drop to 10,000 in order to get control over this outbreak. Total cases in the U.S. have now surpassed 31.4 million, and more than 565,000 lives have been lost. Despite setbacks in the country's vaccination program, more than 30% of all U.S. adults are now fully vaccinated. And one vaccine maker is suggesting COVID shots may become as routine as the flu shot. Mola Lenghi reports.
Tonight, the CEO of Pfizer saying a booster shot will likely be needed within 12 months of getting fully vaccinated. And it's possible people will need to get the COVID vaccine yearly, just like the flu shot.
A likely scenario is that there will be likely a need for a third dose somewhere between 6 and 12 months.
This as COVID cases climb, fueled by variants, all while the Johnson & Johnson vaccine remains on pause after 6 women developed severe blood clots. In Pennsylvania, more than 30,000 new cases were reported in the last week as the state halted the use of the Johnson & Johnson vaccine.
We were able to quickly pivot and make sure that we continue to provide the service to Philadelphia.
The race to vaccinate continues at sites across Philadelphia, where over a third of COVID cases are concerning variants.
So as good as this feels that we're getting, people vaccinated, and we've been successful in doing that, we still have a way to go.
And tonight, concern is growing over multi-system inflammatory syndrome, or MIS-C, that rare, mysterious disease that strikes children after a COVID infection. So far, it's infected more than 3,000 in 48 states, D.C., and Puerto Rico. And now researchers at the Children's Hospital of Philadelphia think they may know one reason why.
And many of these children don't even have any symptoms at all.
Researchers discovered these children have highly activated immune systems that sometimes exceed the immune systems of adults battling COVID-19.
So we're still learning a lot about this disorder, but it fortunately responds really well to treatment.
Meanwhile, in Washington today, frustrations over COVID restrictions boiled over as Congressman Jim Jordan sparred with Dr. Anthony Fauci.
You don't think Americans' liberties have been threatened the last year, Dr. Fauci? They've been assaulted.
I don't look at this as a liberty thing, Congressman Jordan.
Well, that's obvious. What measures have to be attained before Americans get their First Amendment liberties back?
I just told you, we're not talking about liberties. We're talking about a pandemic that has killed 560,000 Americans.
Well, this is the largest federal vaccination site in Pennsylvania, administering about 6,000 Pfizer vaccines every single day. Now, FEMA had planned to switch over to Johnson & Johnson until that vaccine was suspended earlier this week. So now FEMA says they'll keep this site open for an extra month until May 26th. Lana?
Mola, thank you. For more, I'm joined now by Dr. Richard Besser. He is the president and CEO of the Robert Wood Johnson Foundation and the former acting director of the CDC. He's also my favorite doctor. So, Rich, it's good to have you with us. Let's talk about this Oxford University study because it found that the risks of developing rare blood clots in the brain are higher in those who contract coronavirus than in those who just get vaccinated. But Dr. Fauci says that there are some, quote, procedural gaps in how this study was done. I think for all of us at home trying to figure out these new headlines about blood clots, there's a lot of confusion. Can you break this down for us?
Yeah, I mean, the big question, Lana, is does the vaccine increase your risk of getting these rare blood clots? And to figure that out, you have to know how many occur when people aren't getting vaccinated or in other conditions. I would hold off on any judgment around this paper and the data that's coming out of there because it hasn't been peer reviewed. And the peer review process is really, really important to make sure that the way they did the study made sense and that the information coming out can be compared to what we're seeing right now in the U.S. With the J&J vaccine.
So continuing on the same note of the J&J vaccine, Dr. Fauci says we'll hopefully get a decision on that, quote, soon. The vaccine was paused earlier this week following reports of rare blood clots. how damaging do you believe that the decision to pause it will be, as opposed to issuing a warning or an advisory or anything else? And given that, how difficult will it be to actually reassure the public if, in fact, they decide to go forward and start reintroducing the J&J vaccine?
Yeah, it's important, Lana, that the viewers know that our foundation, the Robert Wood Johnson Foundation, owns significant stock in J&J and was founded by one of the founders of J&J. When it comes to the actions that have been taken, I think it was a very smart move to take a pause. Whenever there's a signal of potential safety concern from a vaccine, you want to have the time to be able to investigate that and determine, is it real? And if so, how often does it occur? The committee that you're talking about, the Advisory Committee on Immunization Practices, is the committee that makes all of the recommendations to the CDC in terms of how vaccines should be used. And in their meeting, they said they need a little more time. They need more time to investigate this and determine the way forward. My hope is that this will inspire confidence in whatever the recommendation is that comes out of the ACIP, so that people will have the information they need to make a decision as to whether this is a vaccine they want to receive or whether they want to go another route.
Of course, that's the hope, that it inspires more confidence than doubt. But are you at all concerned, though, that the action of taking it off or causing this immediate nationwide pause is going to fuel vaccine hesitancy?
Well, I think that whatever they decide, it is going to be a real challenge in terms of communication. It's really hard to talk about risk. So if this is real, from the data that have been shared so far, you have 6 cases of a very rare clot that have occurred in people with more than 7 million doses of the vaccine having been administered. So it's extremely rare. And we know we're dealing with a disease, COVID, that is killing hundreds of people every day. And so how you weigh those two things and the choices that people have, one of the things about the J&J vaccine that public health officials like is that it can be given with one dose and people are protected. And there's certain situations, especially where it's hard to reach people, where a vaccine with that kind of profile has a lot of benefit. But it is hard. I think you always want to err on the side of transparency. Let people know what you know and give them the information so they can make an informed choice. I think that if there had not been a pause here, and if this had just been put out there, it would have led to, I think, greater concerns by the public that they weren't being told the full state of the situation.
Let's absolutely hope that people see it that way and appreciate that transparency. Dr. Besser, Pfizer CEO says that their vaccine will likely need a booster dose 6 months to a year after initial vaccination. Are you at all surprised by this? And do you expect that we're going to be hearing similar recommendations from other vaccine makers?
Well, I didn't know what to make of that statement, whether it was a statement for shareholders or for the general public, because the data that have been shared so far have shown that levels of protection at 6 months are still really, really high. And we don't know about protection further out from that because the vaccines haven't been around long enough to answer that question. And so every few months, I expect we're going to see data to see, have the antibody levels, the protective levels in people's blood, have they started to decline? And have they declined to a level where the feeling is you need a booster? The other factor in there, Lana, is whether there are variants that come around that these vaccines aren't effective for. And in that situation, you could imagine that there might be boosters to cover new variants. We know with the flu vaccine, we need to get it every year, but there are a lot of vaccines we give to kids. I'm a pediatrician, where you give them 1 dose, 2 doses, or 3 doses early in life, and they're protected for the entirety of their lifetime. I think it's too soon to say what the outcome is going to be for COVID.
Before we wrap up our conversation, I want to set aside a little bit of time to actually talk about global health, which I know is another area of your expertise. MSF is calling on Brazilian officials to acknowledge the severity of the crisis. That's a quote from them, adding that the nation does not have an effective public health response more than a year into the pandemic. How much worse could this outbreak get if this continues? How concerned are you about the similar rising cases in India? And how might all of this global fight against COVID impact us here in the United States?
Yeah, I mean, the reports coming out of Brazil are really tragic. Just a devastating level of disease transmission right now. And when you think about vaccine distribution around the globe, the vast majority of vaccine has been purchased and is being given in wealthy nations. This is bad from, I think, an ethical and moral standpoint. It's also bad from a perspective in terms of the future of COVID in the United States, because as long as the virus is transmitting so extensively around the globe, it has the opportunity to mutate. And so far, the mutations that have occurred are still covered by the existing vaccines, but that isn't necessarily predictive of the future. The more these viruses spread, the more there's the opportunity for a mutation to occur that these vaccines won't cover, and that would be absolutely devastating.
Such an important point that you raise. Dr. Richard Besser, as always, thank you.
Thanks so much.